The important things that a patient should know about AFib is every little funny heartbeat is not AFib. So if you have a couple of funny heartbeats, that can just be that, a couple of early heartbeats. But if it's persistent, AFib requires treatment. It requires consultation with your doctor and probably treatment because there are risks associated with AFib. And they are these. They are threefold. One, remember we said the upper chambers may not be contracting in a coordinated manner. That means there can be areas where the blood is becoming stagnant. It isn't flowing rapidly down into. When blood becomes stagnant, it can form clots. If those clots break free, they go down to the lower chambers, out to the body, and possibly up to the brain, where they block an artery to a part of the brain and cause a stroke. Devastating complication of atrial fibrillation. Secondly, just the fact that the upper chambers aren't pumping can decrease the efficiency of the lower chambers. They're getting less blood into them. So patients may not be pumping as much blood as they go through the day and can have a general sense of fatigue. Now that symptom is quite variable. Some people tolerate atrial fibrillation extremely well, don't even know they have it. And other patients become profoundly weak and tired. And we don't really understand why some tolerate it so well and others don't. The third problem with atrial fibrillation is it can drive the lower chambers to be beating very fast. If the lower chambers beat fast, very fast, 200 beats a minute, over a prolonged period of time, they wear out, they start to fail. So instead of being able to beat like this, they end up like this in what we call heart failure. And it has a fancy name called tachycardia-mediated cardiomyopathy, which simply means fast heart causes sick muscle. So those three risks of atrial fibrillation, when you reflect on them, are pretty significant. So patients that have AFib need to see their doctor and need to follow the treatment regimens because the results of not doing so can be devastating complications.